There are really two trends. One, the major trend, of course, is to make more physiologically relevant models, for i.e., making models that are more predictive. And I think that is very good. The other trend is to try and make models more complex. And I think, again, that has its advantages in that you're making a more physiological model. Particularly, I think the big advance just now is the introduction of immunology. So because many diseases and many effects actually involve the immune system. So I think actually involving immune components is very clever, and it is really good. I think the reliance on the problem, I think, is when we move to these organs on chips, where people are using the word organ. In fact, we don't have, or no one has an organ. If you take, for example, the kidney, which is, even in terms of tubular cells, is made up of at least 10 different types of tubular cells. Each has its own environment and microenvironment. We just cannot reproduce that complexity. I think we've always did. Newcells are driving innovation by using its we've always called it, best in biology. So what we've always been trying to do within our in vitro models is not think about how to build the best MPS chamber or the best perfusion chamber, but actually to build the best biology, so that we can take the best biology, something that really is representative of a proximal tubule or a retina or airways, and then put that into an MPS system. So we're doing it from biology to MPS, which is an evolution, whereas many people are doing it the other way around, which is let's make a clever an engineered model, and then try and load it with cells. And that's where I think that's where we lead, is that we lead by doing it the right way around, get the best model, improve it, rather than the best piece of plastic and then try and make it work. I think the biggest change that we're seeing is that people are moving away from generic cells, like, for example, HK2 cells, which are dedifferentiated, or generic endothelial cells, to tissue-specific cells. So we're beginning to look more to the biology to put the right cells in the right models, and also make models slightly more complex to answer the questions. So if you're looking at immunology, then you really need a more complex model than if you're just looking at transport, where a simple model occurs. So I think we need to have this differentiation in the market. We have a place for simple models, we have a place for complex models, and we need to ask the right questions of the right model. I think Newcells do keep innovating and making new models. The innovation is planned, and as you know, we really think strongly about why we're making a new model. So what drives the new model is usually a customer need. So a client may come to Newcells and say, we would like to understand this about our model, and we will then, in to the best of our abilities, either build a model or adapt a model so that we can answer that specific question. So I think where Newcells has a strength is that we are flexible, we're adaptable, we're innovative, and we're agile. I think there'll be, firstly, I think two things will happen. Firstly, there'll be a realization away from the hype, because I think there's a great hype on models. People were actually hyping up models, saying they can do lots more than they can actually do. So I think we're moving past that hype into this realization of what current models are actually able to do. And from that, I think we're now slowly building better models. So I think we're being more realistic. Whereas in the initial phase, I think what really was, oh, we can replace a human, we can make a human on a chip. Now I think people are saying, okay, that was a bit of hype. Maybe we're starting to build the components, which maybe in 5 years' time will allow us to make a human on a chip. And I think that's the best thing. that almost that people are realizing and sitting down and saying, okay, it's more complex than just putting a piece of tissue into a 3D model with flow. It's much more complex than that in terms of how to get there. And I think that's what we, over the next 5 to 10 years, I think we as companies we will actually get there. I think companies are starting to realize and rationalize and talk to each other and put together standards and standard way of testing models. And I think that will allow us to actually be able to say, we'll look at model from this company against a model from this company against a model from this company using a standard set of testing